If you're stuck trying to break into data analytics, you do not need another portfolio. You need healthcare experience. And there's going to be a niche in healthcare that most people do not even know exists, but it drives real money and real outcomes. It's quality and performance. And it's going to be under terms that you've never heard before, or probably never heard. Stars, HEDIS, risk adjustment, HCC. In this video, I'm going to explain what those terms mean and why this is one of the best entry lanes into healthcare analytics. So, a quick story is I did not start as a data analyst. I started in the aftermath of the 2008 financial crisis and the year after as a marketing major who couldn't find a job trying to do anything. I tried to get hired as a receptionist. I tried to get hired as a video game tester. I tried to get hired in any role that I could get hired in. And the only thing that I was able to get was a temp data entry position at a healthcare medical group. It was something that paid the bills. They needed extra manual help typing in the diabetic lab results from faxes and PDFs that were sent in so that they could meet their quality measures. This was mind-numbing work. And this is actually how I fell into the podcast, but I had to literally hide the clock on my computer. Otherwise, it would be agonizing. I would be regretting life and thinking that I wouldn't be able to get through an 8-hour shift of just data entry. But it put me in a department where leadership cared about the data because it was tied to performance, incentives, and reporting. And eventually I became the assistant to the team that handled all of it. This was a low-level role that gave me niche experience that was tied to real business impact. And then that's ultimately what led me to getting a healthcare analytics job. I first became a data analyst. And then here's a quick clarification because people do miss this up is there are two great places on the healthcare business side that you can get into. You're going to hear people talk about revenue cycle, which what they mean is it's going to be this term FFS, which is going to be fee for service billing. This is where you're going to hear what claims, denials, collections. That is one of the main money drivers and revenue drivers in healthcare. But the lane that I started in was the other revenue engine, which was quality and performance. FFS is fee for service. Someone goes in for a service, they bill the insurance company, the insurance company pays. The other side is what I got into, which was value-based and capitation. You got paid, the providers got paid for the results. And I was literally, so part of what I was helping with too, as I helped out the finance department, and I would be helping with the capitation checks. And we would literally be on, I think it was like payday on like a Friday late, printing out all the massive checks depending on how many members that those providers had. So you want to think about fee for service is simple. Fee for service is care happens, the claim goes out, which is think of it as the bill, and then money comes back. But value-based care is going to be different. Payment changes based on the performance of the provider. Sometimes there could be bonuses, also there could be penalties, and then sometimes through capitation. And then capitation is basically, you can think of it in this term, PM, per member, per month. And so what that means is based on the members that all those doctors had, this capitation check would change. So you would think about, let's think about Medicare. This is going to be the senior government program for seniors over 65 or those people with certain disabilities. Capitation would change depending on how sick they were, the chronic conditions. So then the government would allocate a higher budget for those members. So if a doctor had one of those members, they would be allocated more money to handle their care. So now you would think about it's centered around delivering better care, documenting it correctly because that changes the payment. And then so this is where all of that alphabet soup is going to be coming in. So you're going to see these words, but I'm going to focus on these specific words first. We're going to talk about risk, HCC, HEDIS, CMS stars, P4P, also known as pay for performance. So here is going to be a quick translation of this. So risk adjustment is going to be the payments are going to shift based on how sick the population and the member is. So this depends on accurate documentation on medical records. So depending on how the provider documents the diagnosis, there's certain diagnosis. This is where they need to be very accurate in what the member needs. And this is also where fraud comes in, because there are some providers that will overdo what the member actually has so that they could get more money. So there's a whole dedicated analytics side that you could go into that prevents fraud, waste, and abuse. Now, for risk adjustment, say they have diabetes, they have high cholesterol, hypertension, and chronic heart failure. All of those have a certain risk score. And the way that Medicare works in the US is there is a entire huge budget that is allocated to all the members that are going to fall under Medicare. Now, depending on how your risk score or your risk adjustment score is going to be, you will multiply that. And then that's how much that member is going to be allocated depending on how sick they are and how much care and money that they need to maintain their chronic conditions so that they get treated to the level of care that they need. That is risk adjustment. Now, HCC is going to be the specific diagnosis that are related to risk adjustment that drive that risk score. Also, that risk score is also known as RAF, which is that bottom, which is this bottom one right here, which is going to be risk adjustment factor score. So you basically add all your HCC, chronic conditions that are going to be paid. The health plans are going to get a certain budget from the government, and then the health plans move that money down to the providers and the medical groups who manage them. Now, HEDIS. HEDIS is standard quality measures across the nation. You can think of this as standardized testing for all the different health plans, the providers on different levels of care. So you can think of screenings, chronic condition cares, making sure that people have their colonoscopies. If they have these certain measures, did they get their where is their blood pressure at? And then making sure that they have all the other relevant quality performance or quality care that signals that the member is getting the level of care that they need. Now, tied to this is going to be CMS stars. This is a Medicare plan specific scorecard. So plans and clinics and providers care about CMS stars because the higher the star rating means you often have a better bonus outcomes and positioning inside the market, because it's a way for people to compare health plans against each other when like a plan has a 5-star versus a 4-star versus a 3 or 2. Now, the last one on the bottom is pay for performance. So then hitting these various targets also has extra incentives provided by different quality government programs that are out there. So you're going to get, or the provider's going to get bonus money, health plans for hitting targets. So for all of these, you do not need to memorize this. You just need to know that they're all related to assessing the quality care that's given to certain members, and then basing that off of those numbers will get revenue and a budget towards those members. And then those providers will get a capitation check that will be related to all of this. And then also extra incentives and bonuses on top of that. So this is going to be the performance side of healthcare, which moves money, but it also moves patient outcomes. Now, this is going to matter because if you're trying to break into healthcare analytics, most people who are trying to get hired have the same problem. They have skills, but they have zero healthcare workflow experience. So when I say workflow, it's basically being inside the different business processes within healthcare, like all of these quality measures. So quality is a great lane because it forces 3 things fast. It's going to force One, which is going to be you learn the language. You learn the healthcare language, you learn the terms, you learn the workflow. Two, you are working with measurable data. And because it's measurable and because it's tracked and it's incentive tracked, it's easier to show impact. It's easier to talk about impact. It's easier to show revenue impact. And then three, there are going to be many entry points into these different roles or into different departments that will be able to support these that don't have the analyst title, but maybe a step down, but you'll still be able to work with the data and apply your analytics skill set and then make the same type of impact and then transition easier into a healthcare analytics role after. Now, here is what you're going to search when you're looking for jobs on job boards. So you want to be able to look for these types of roles specifically and not revenue cycle. Revenue cycle is a great area, and we'll be talking about that in the future. But for quality specific, you're going to look for the keywords that we were looking at earlier. So it's going to be all of these. So you're going to look for risk adjustment, ATC, RAF, HEDIS, CMS star, quality, value-based provider performance or incentives, and then pay for performance. So common titles that you would see is going to be risk adjustment analyst, specialist, coordinator, HEDIS analyst, quality reporting, quality improvement, stars analyst, provider performance analyst, provider incentives, care gap analyst, population health analyst. And then you'll also see things that are going to be slightly related, but a little bit different. You'll see stuff like healthcare econ or healthcare economics. I'll dive into that more specifically there, but you can also look for that. And if you keep getting these billing roles, try excluding keywords like billing, collections, AR, or denial, because those are going to be specifically fee for service revenue cycle, which is a different lane. Now, if you're struggling to break into those analyst roles and to healthcare and data analytics in general, here's going to be what you want to try instead. Consider getting a lower level role that could be a step down or just in the department so that you have the data exposure inside healthcare. So you're going to try to get it inside the quality performance side. This niche is very specialized, it's in demand, and it's tied to real business impact. And it often transitions easier into healthcare analytics roles because you're inside the workflow and you get to understand a lot of different parts of the business and then transfer it into a new role. Because I was on this side, I worked on the Medicare Part C side, which is the Medicare Advantage, where it's basically where the health plan combines with the government Medicare benefits, and then they provide their own private insurance for seniors over 65, combining it with the revenue that they get from the government, but they add on specific things like medication and transportation, hospital benefits, other things depending on the plan. So because I worked on the Medicare Part C side, I was able to get my current role, which is specialized in the Medicare Part D side on the pharmacy medication benefit side. So because I was able to learn all of this on the Part C side, I was able to easily get a job over there at a major Fortune 5 company later. So it's one of those things where if you can get in and learn, apply the knowledge, and then you'll have a specialized skill set, and then you'll be able to bring it to a lot of different places afterwards. And you don't have to start in a data entry field like I did. If you can't find anything else, then that's a great place to start because that's what I had to do. But you can aim for directly for support roles inside these departments. Think assistant, coordinator, specialist, and then any of these keywords that you see here. And then once you're in, you have the analytics skills to become that you can use for leverage. And then you'll be able to improve real business performance and then improve real patient outcomes at the same time by supporting the systems and incentives that push better care. Now, you don't have to have the perfect start. You just need the right lane and know where to look. Now, if you want help breaking into healthcare analytics or building real experience, apply to the Healthcare Analyst Lab. This is where I help you build real projects, teach you different workflows, and have courses to help you break in easier and faster. So apply. There's going to be a link in the description below. It's free right now and would love to see you there because we are testing out the new healthcare analytics pivot, which is going over everything that I know of how to transition into healthcare faster and easier. Now, the next video, I'm going to break down the best entry level bridge roles into healthcare and exactly how to turn them into analytics experience. So watch that now. And until next time, query responsibly.